Why is understanding my breast cancer pathology report so hard? Imagine receiving a report filled with words and numbers that seem like a foreign language. That's often how patients feel when trying to understand their breast cancer pathology report. These reports are primarily written for doctors, using complex medical terms and detailed technical language. They include important information about the cancer's type, grade, hormone receptor status, and other factors that help determine treatment options. But for someone without medical training, it can be overwhelming and confusing. One reason it's so difficult is the medical terminology. Pathology reports use precise words like ductal carcinoma in situ, which means cancer cells are confined within the milk ducts, or histologic grade, which describes how abnormal the cancer cells look under the microscope. Terms like estrogen receptor status or HER2 status tell doctors whether the cancer might respond to specific treatments, but these words are unfamiliar to most patients. Without explanation, they can seem intimidating. Another challenge is that different laboratories and hospitals may format their reports differently. Some reports are very detailed, especially if they come from surgical biopsies, while others from needle biopsies might have less information. This inconsistency can make it harder to compare reports or fully understand what they mean. Interpreting the diagnostic nuances adds to the confusion. Pathologists sometimes find it tricky to distinguish between benign, non-cancerous, and malignant, cancerous lesions, especially when tissue samples are small. This can lead to different opinions or the need for additional testing, which makes understanding the report even more complicated. Even among experts, there can be variability in how certain findings are interpreted. For example, some lesions might be classified as atypia, which indicates abnormal cells that are not yet cancer but could develop into it. This diagnostic variability can make it harder for patients to grasp the exact nature of their diagnosis and what steps to take next. The report also includes prognostic and predictive information, like tumor size, grade, lymph node involvement, and hormone receptor status. These details help doctors decide on the best treatment plan but requiring some background knowledge to understand their significance. For example, knowing that a tumor is hormone receptor positive suggests that hormone therapy might be effective. Receiving a breast cancer diagnosis is emotionally challenging, and processing all this detailed information can feel overwhelming. Stress and anxiety can make it even harder to focus on understanding the report fully. To make sense of these reports, patients are encouraged to ask their healthcare providers to explain the findings in plain language. Requesting a copy of the report and reviewing it with a trusted doctor or patient navigator can help clarify confusing terms. It's also helpful to seek a second opinion if there's uncertainty about the diagnosis or recommended treatment. Using reputable educational resources that break down common report components can empower patients to understand their situation better. In the end, breast cancer pathology reports are detailed documents designed to give doctors the information they need to plan treatment. Their technical language and variability can make them hard for patients to understand, but open communication with healthcare professionals and trusted resources can bridge that gap. Remember, every person's experience is unique, so personalized medical advice from your healthcare team remains essential.